Hi, this is Colleen Parsons with a lecture on the thorax and lungs for health assessment. This is part 1. Within these 3 parts, I think there are 3 parts, there are answers to your quiz, so you should watch all 3. Review your anatomy, review your skills checks. A lot of the things that we're going to be talking about are right here in your skills checks. So we're going to be talking about the shape of the thorax first and the chest symmetry of the chest wall. The presence of superficial veins that you'll see are the blue veins or anything that comes very near the surface of the skin. The costal angle is the angle between the ribs, should be a 90-degree angle. Intercostal spaces we'll talk about. You already know what those are. Intercostal spaces are the spaces between the ribs. We need to note respirations, rate, pattern, depth. Are they audible or are they quiet? Is there any sputum present, any mucus, or is the patient coughing anything up, or do they have any sinus trouble? Mainly coughing with the respiratory assessment. General palpation is feeling all over for any masses or lesions and inspecting the skin, any tenderness or pain. You all keep forgetting about tenderness and pain, so please remember that. Pulsations, do you see anything pulsing, especially along the aorta? Masses, do you notice any masses that are sticking out? And they are often, that does happen on a regular basis, especially in the chest area. Any tenderness, this is all with palpation. Crepitus is that crackly feeling you feel under your fingertips. And as you palpate, you will feel it. I've only felt it a time or two in my career, but you may feel it much more often depending on where you work. Thoracic expansion is when you put your fingers right on the base of the sternum, and when your patient takes a deep breath, do they move your fingers apart, and do the fingers go back together? Tactile fremitus is when you're putting your hands in the back, and we'll talk about this again, 99, 99, and you're feeling it not with your fingers so much as with this part of your hand, okay? You're going to see if there's a symmetrical vibration that comes through on both sides when the patient says 99. And again, we're going to be concerned about the tracheal position. So as you're beginning to see, things are beginning to overlap a bit with what you have already previously learned in your skills. The general percussion, general percussion is when you put your fingers between the intercostal spaces, or on anything you're going to learn about doing it over organs as well, and you are tapping to see if there's a sound difference. And again, I feel it more than hear it. General auscultation is listening to all of those spaces, and you'll learn 1, 2, 3, 1, 2, 3, 4, 5, 6, and then at least the 6 spots on the back. Many people will tell you don't listen under the breast. We have lungs there, and I don't know how you tell the bases. And then don't forget you have 2 spots on the sides. It can very often be easier to hear the bases on the sides. Note the normal breathing sounds for your patient and their voice sounds. And that would be saying E, and then how does that sound when you're listening with a stethoscope? That's the voice sound. So we'll cover that, I hope, here in a minute. If you are able to get on Jarvis, into Evolve Elsevier, you will see they have some really cool videos in there, especially now that we're getting into more intricate skills assessments. And this is just directions on how to get there. Okay, structure and function. Review all of these. The ones with the stars on them are the ones that I am most concerned about, but here is your costal angle. So you'll be putting your thumbs right here at the sternum to see what kind of an angle that makes. It should make a 90-degree angle. If it's making an angle wider or more narrow, that's abnormal. Here are your intercostal spaces. These become very important when you're listening to, when you're auscultating the heart as well as the lungs, so that if you're hearing something interesting, you'll be able to say, well, at the 7th intercostal space, I heard, okay? And your costal margins are right here. So again, your thoracic cage. So you're putting your thumbs at the xiphoid process. And your posterior thoracic cage. So you will not auscultate over the scapula. You're going to go 1, 2, 3, 4, 5, 6, 7, 8. Okay? These are all interesting to read if you're a reader. Know your reference lines. So here's your mid-sternal line. Here's your anterior axillary line and your mid-clavicular line. So it's right half cuts the clavicular in half. And your vertebral line and your scapular line. It's cutting them in half. You know there's 3 lobes on the right and 2 lobes on the left. Remember that? For the lungs. And know your trachea and your bronchial tree. They're all really important. Mechanics of respiration, right? Your structure, your pulmonary veins, your pulmonary arteries. All this is vitally important that you remember it. And your mechanisms of respiration. What does the body actually physically do when you're taking a breath in and when you're taking a breath out? Pregnant women with an enlarging uterus, what happens? It elevates, pushes the diaphragm up 4 centimeters during pregnancy. That's a fair amount. And this decreases the critical diameter of the thoracic cage. But this decrease is compensated for by an increase in the horizontal diameter. So there are specific changes, and I think you better write that down. I can't remember if there's a quiz question on that or not, but I think there might be. Can't remember if I took it out. Oh, no, there's one. So remember what this stuff means here. Aging, what happens? The costal cartilages become more solid, they become calcified, they're less mobile, so people can't take as deep a breath. The aging lung is more rigid and harder to inflate. So there's a little bit of shortness of breath that may come just with aging. With aging, histological changes, gradual loss of alveolar septa. I can say that unless I'm talking to you guys. And a decreased number of alveoli also occur. So there's less tissue available for that gas exchange. TB is still a pretty big problem in this country. The rates for TB were 11.5 times higher in foreign-born people than those born in the U.S., and 8.7 million new cases of TB worldwide were diagnosed in 2012. The incidence of multi-resistant TB is increasing because, just like antibiotics, people don't take all of their medications. Culture and genetics, so 8.4% is the prevalence rate of asthma in the U.S. in 2011, and some say that that's a pretty low number because there are more people, a significant number of people go undiagnosed. And that's the end of part 1.